is Senate Bill 132. Senator, if you would, come forward. If you would, introduce yourself for the record as well as your guest, and feel free to proceed.
Thank you, Mr. Chairman and members of the Health Services Committee. My name is Donald Douglas. I am District 22 State Senator, and I will have my guests introduce themselves.
My name is Lindsay Cox, and I'm a registered nurse. We're currently working in the emergency department.
Name is Bill Werman. Been working as an emergency room physician for 20 years.
Greg Chaffwin with Alliance Defending Freedom.
Please proceed.
Thank you, Mr. Chairman. Again, good morning to the Health Services Committee, and good morning to you, Mr. Chairman. Mr. Chairman, Senate Bill 132 is a common sense bill. Some of you all may have received some texts, some emails, or even some calls regarding this bill. So let me clear some things up and let you know what this bill is, and also clarify what this bill is not. This bill is not a challenge to the social structure. It is not a policy bill. It is not a get out of jail free bill for those who decide that they don't want to fulfill their duties. What this bill is, it is a recruitment tool. It's an economic development tool. And it is a tool that basically says, welcome to the Commonwealth. We really look forward to your business. And even though we expect the highest level of professionalism from you, we will honor your moral conscience, as we do for all Kentuckians. There's no question that we have a healthcare provider shortage in this state, and there's also no question that our healthcare provider maldistribution is a problem. These things alone, well, they're really extending the waits that our consumers must face when they go to see their doctors, their nurses, get laboratory tests, or even get procedures done. The pressure in our healthcare system and on our healthcare people is tremendous. And if we add in, you do things the way I tell you, or you won't keep your job, that makes it much more difficult to recruit competent healthcare providers in our state. You know, we don't ask those things of people like bankers or assembly line workers or construction workers, or even our people in the public assistance arena. We give them the civil rights. But sometimes we look at our healthcare providers and we tell them, you do what we tell you to do, even though you're the ones who went to school, took all the time to learn what you're learning, and spent all those nights up. This bill, there are definitely some people who don't mind violating their own consciousness when they want to do procedures. But you know, for those who have strongly held beliefs and they want to live by those beliefs, that's what this bill is for. This bill protects them. Some may suggest that these protections exist at the federal level. But if they actually go and look at the federal documentation, what they find is that at the federal level, all it says that if we have an institution, it really protects the institution. If the institution is accused of discrimination, it simply withholds funds from that institution until those problems are corrected, and then the institutions get their money. It doesn't protect the individual. We need to have individual civil rights, even as healthcare providers. Now, I'm sure all of you have read the bill, and I'm happy to go over the bill section by section, but you know, we have some people here who have some stories and some people who have expertise in this area, and I would prefer to let them do the talking, Mr. Chairman.
Please proceed.
It's a real pleasure to be speaking to you all. Thank you, Bill Werman. So I have been working at the hospital, St. Joseph London ER, for 14 years. And that ended last year. I'm currently working in Paris, Kentucky, but I want to focus on two main things. It's a real privilege to work in the emergency room, and I can think of so many heroic people that work in healthcare, in the ER, nurses, physicians, respiratory therapists, paramedics. I think they all have heard the line, patients They don't care how much you know until they know how much you care. So I've never in my 20 years of working have ever seen a patient turned away. By all means, those patients that come to the ER, they're going to get care. They're going to get triaged, and they're going to get a medical screening exam, and we're going to make sure that we're going to take care of any kind of emergency thing going on with them in a respectful and caring manner. But the other thing is, we really are having a significant healthcare professional shortage problem in the state of Kentucky. How many instances of we don't have this specialist available, GI, urology, interventional cardiologists. We can't operate our heart cath program on these days this weekend because we don't have an interventionalist. In those situations, you just have to coordinate with outside hospitals, and that involves transferring the patients. Then you're running into the problems of there's a paramedic shortage too, and so we get the call back, well, we've only got 2 trucks available tonight to use. And so you run into problems with that. You end up having to fly patients, to get patients to different places. It's not the best way of use of dollars for sure, but nursing shortages. Hospitals might say we don't have the beds, but a lot of times when you talk to the nurse supervisor for the evening, it's where they don't have the nurses to staff those beds and those patients, so the capacity is limited. So you do run into it regularly, and I think having this bill, if it would pass, I think it would be a big boost to attract more qualified healthcare professionals to come and serve in this state, and I think it would be a help. Thank you.
I'm here today because my own career was impacted by a lack of conscience protections. As a nurse, when I was deciding what field or specialty I wanted to work in, I changed the direction due to ethical concerns about being forced to participate or being coerced to participate in procedures that would violate my conscience. For example, I hesitated to work in women's health, which something I was extremely passionate about, due to concerns of being coerced again or forced to participate in procedures as well. If I knew that the state of Kentucky protected my rights to conscience, I would have been free to choose my career path without fear of being kept out of that area because of my beliefs. I know many of my peers and my colleagues feel similarly. As a registered nurse, I'm also continuing my education right now, and I hope to be a nurse practitioner eventually. So as a nurse now and a nurse practitioner in the future, I would hope that the state of Kentucky would see that we need protection as much as our patients do, and that we have beliefs that we walk into medicine with and that we want to hold on to as we take care of our patients. And we would appreciate your support on this bill. Thank you.
Mr. Chair, I'm available for any questions after the testimony, but I would just highlight a few things about the bill that I think are relevant and important. First, this is about conscience protection to not being forced into doing a particular procedure or service. It's not about allowing a healthcare professional to do whatever they want if they think their conscience tells them they ought to do it, just that they shouldn't be forced into doing something that violates their deeply held, sincerely held religious or ethical beliefs. Second, it's focused on procedures or services. There's nothing in this bill, and we wouldn't even defend a bill if it allowed denial of services because of conscience objection because of who a person is, or even their lifestyle choices that might land them in the doctor's office. So there has to be something about a procedure or service that violates the conscience of the healthcare professional, nothing about the particular person being served. Third, I would say this is very important that it provides emergency services, as has been said. The bill is explicit that it does not apply to emergency services, which is governed by federal law. And this also makes sense because healthcare professionals don't have conscientious objections to providing life-sustaining care. And this is also why it works in 6 other states that have had very similar legislation, in one case for almost 20 years. It works as intended, protecting conscience rights, and it is not overused. There are a few cases when this is actually used, and that's meant to be how it's supposed to work, so that a healthcare professional can assert a conscience right to when they need to, but they don't overassert them. So there should not be concerns that this will lead to an increase or a number of cases. It just sets the correct standard for how conscience rights should be protected for healthcare professionals. And then, of course, we have our excellent healthcare professionals here with us today, but I think it is also important to highlight that this is good for patients, and it's also good for the practice of medicine as a whole. Patients want to know that their healthcare professionals working with ethical integrity, and that they won't be forced to do something that they think is unethical. And this protects their ability to know that, because it helps the professionals know that they can work with their conscience intact. It provides more opportunity, more diversity for healthcare providers, because patients can actually find somebody that they agree with about their healthcare and find procedures that they want for themselves. This is how that has diversity. If you don't have conscience protections, you wouldn't be able to get a second opinion about particular procedures and treatments that there's a mandate that people have to do things a certain way. And finally, it's good for medicine. Of course, the scientific method progress requires a hypothesis, testing, results, questioning those results, and repeating it. Very important in that development of medical science is the questioning. You look at the research, was this study done well? Does it actually lead to the results that you want? And then, of course, are there ethical concerns with those things? There are many things we can do, but healthcare professionals need to know that they can ask, should we be doing this? Especially as technology is rapidly increasing. We can do many things, but this will also protect their free speech rights to be able to ask, should we be doing this as well? Thank you.
There's a motion second on the bill. We do have some questions. Dr. Warman, again, can you give me the committee some practical examples where your conscience has been challenged during your career?
I, myself, Senator Meredith, have not been asked to perform a procedure that has violated my conscience. I work in emergency medicine, so I think other fields, I've heard their stories, and so I believe it does happen, where they're being pressured to violate their conscience by performing some procedure, or at least feeling the pressure to do so.
Mr. Chairman, if I may, I'll answer that on two occasions. One being, as you know, I'm an anesthesiologist. And one of the first things I did when I met with my director of anesthesiology when I started my residency is I went to his office and I asked him if he would honor me and my request to not do anesthesia for abortions. That's me. If he'd have said, no, I can't do that, I would have respected that. I would have went to another program. But he did respect that. Why? Because he has a bunch of other residents they're training who are easily willing to do that. We have to understand that there are a lot of different physicians who have different approaches, a lot of different healthcare people who have different approaches. This is not a one-size-fits-all, and we just want to make sure that it is not a one-size-fits-all. I during my training, did feel that. I also did non-narcotic pain management for a number of years, and one of the reasons I went into that particular specialty was because initially, when I did pain management, the clinic I worked with insisted on writing for a lot of opioids for the patients to keep them coming through the practice. How has that worked out in the substance use disorder area, Mr. Chairman? It hasn't. So because I exercised my right of conscience to say this is not working, I believe I've saved a lot of lives. I believe I've saved a lot of addiction over the years. And we need to be able to offer those people who are highly trained, who know more, who truly do know more, whether those people want to believe it or not, who truly know more about their profession than someone who doesn't do this training. We need to make sure that they have the space to make the decisions that they're trained to make.
Certainly, I would agree with you. But my interest in this bill probably goes a different direction. I think when you look at folks who speak out against this bill, they're afraid that, again, the abortion issue, which you've addressed, and we've kind of already addressed that by the U.S. Supreme Court, but also denying service to the LGBT community. And I think what we're missing here is the challenges from the corporatization of medicine, that corporations are now dictating how healthcare professionals should act, could act, and I think this could offer some protection against that. Remember during the COVID crisis we had, one particular hospital in Texas physicians were told to no longer do chemotherapy treatments, that they were reserving those beds for COVID patients. Would you have a moral objection to something like that?
Mr. Chairman, when I went to medical school, my conscience told me to treat everybody and to treat everybody fairly, as fair as I could, within the moral conscience that I have. I don't not do something because I don't like a particular diagnosis. I never think about whether I like a patient or not. In fact, I spent a lot of time in my practice with people who came in concerned about these types of things. Well, most people don't want to treat me because of this. And I would correct them and say, I don't think that's true. Just because we believe something doesn't make it true. It doesn't make it accurate. It does create fear. And part of my job as a doc is to educate people and help them move past their fears, because as physicians, we don't treat people because of feeling. We are, unfortunately, terribly objective. We look at the patient. We look at the symptoms. We look at the diagnosis, and we try to figure out what can we do to help with this situation. We don't look at how many kids they have. We don't really, that doesn't really affect how we treat the diagnosis. We don't look at what their social life is. That doesn't really affect how we have to treat them in an isolated instance.
Duly noted. We have 4 senators who have asked to ask questions or make comments. I'd ask you again, out of respect for the time we have to do this, be short in panel if you would. If you have a question, I'd appreciate if you could be short in your answer as much as possible. Senator Rawlings.
Thank you for bringing this bill, Dr. Douglas. In our Kentucky Constitution, it says no human authority should interfere with a person's right of conscience. So don't you think this bill is just a good segue? It's a logical fit with our constitutional rights that have existed since the 1800s.
I think this bill brings people in the healthcare space on an equal footing, as it were, with all the other Kentuckians here in the Commonwealth of Kentucky. For a long time, everyone has seen physicians as special, but they also felt like they had control, that the doc should do whatever we want them to do and how we want them to do it. I think this gives some of the power back to our healthcare providers in terms of what they want to treat, how they want to treat it, and when they want to treat it.
Yeah. Agreed. Thank you.
Senator Richardson.
Thank you. I'm just going to be very brief and pose a hypothetical just to clear anything up. If there's an unwed mother who becomes pregnant through her choices or choices forced on her, because we're talking about treatment and procedures, whether it be conscious of a religious belief or personal beliefs, that they don't believe in sex outside of marriage, would that procedure to take care of the baby and take care of the mother through her pregnancy still be able to be performed? Because it's procedure and
Correct, Mr. Chair, Senator Richardson, you're correct. If there has to be something about the procedure itself and providing services to a pregnant woman, very few people have objections to that, so it would not apply to that situation.
Senator Herron.
Thank you, Mr. Chair. I do have 2 quick, brief questions. The first one, I think that someone mentioned that there were 6 states who've passed similar legislation. What are those states?
Senator Herron, Mississippi, and Florida, Montana, Ohio, South Carolina, and Arkansas.
Thank you. And my other question, this is just clarity, and Senator Richardson kind of got to it, but we have been doing a lot of bills around religious beliefs and allowing people to serve people or not serve people. And this is a question that I just really want clarity, just because I don't understand. If there's a patient who happens to be a Jewish patient and someone decides that they do not want to perform a procedure on this individual, would that Jewish patient be would that doctor be covered under this, or could that Jewish patient then say that that doctor was participating in anti-Semitic behavior?
If I may, I'm happy to answer that question. One of the things I really, really want to emphasize here is that highly trained medical professionals don't view the patient population the way our general population views the patient population. We go into medicine because we want to care for people. We don't look, for the most part, at any of those. You may have a rare instance, but our job as legislators is to legislate for the masses. And then we can come back and we can do amendments for the exceptions. But one of the things I don't want is I don't want the tail to wag the dog. And whenever we try to legislate out of fear, we are not being leaders. We need to legislate to the masses. And when we put constraints around the masses, we don't do a good job as legislators.
That didn't answer the question as far as in that particular situation, would that doctor or professional be covered under this, or would that patient be able to say that that doctor was acting or participating in anti-Semitic behavior?
Well, I think what we're looking at is a hypothetical. And we can come up with a lot of hypotheticals and make them as small as we want to, so that we make the decision-making process, the little hole to make the decision, as small as we can. I think those are things that we need to look at in terms of amendments. But that's not what this bill is about.
Last question from Senator Mills.
Thank you, Mr. Chairman. On the very back of the bill at the end in Section 6, we kind of watch for these every once in a while. This does have a civil cause of action in it, and I think you barely touched on it. I wanted you to be clear on that. This just kind of gives the bill teeth. Is that the way you're looking at it? And this isn't meant to be a lawyer bill in any way, one way or the other, correct?
Mr. Chair, Senator, you're absolutely correct. In these states, some have had them for almost 20 years. It's not used very frequently, and it's just a matter of enforcement that hospitals actually have to take it seriously, because without a cause of action, they really don't need to.
Thank you. Appreciate your testimony. Senator Douglas, you may want to hang out in the back there. I'll call you back to the table once the folks who speak in opposition to the bill have an opportunity to testify.
Thank you, Mr. Chairman.
And I originally had committed to do this in 30 minutes, but obviously that's not going to happen. But to that end, we do have two other bills that we need to hear. I have 7 people signed up to speak in opposition. I'd ask you folks, as I call you up, again, don't be redundant in your message. I don't know if there's one person, 2 people that want to speak on the same terms, but we just need to be concise in our presentation. And if everybody wants to speak, I can give you 2 minutes to testify. With that, Dr. Karen Abrams, you're first on the list. If you would, make sure that green light is on in the microphone. Identify yourself for the record, and feel free to proceed. And you have 2 minutes.
Chairperson Meredith and committee members, thank you for allowing me the opportunity to testify today. My name is Dr. Karen Abrams, and I'm a pediatrician and physician in Kentucky. I stand in opposition to Senate Bill 132, a bill that puts the health and safety of Kentucky residents at significant risk. As a healthcare provider, I take an oath to care for all of my patients, putting their needs and well-being above all else. Senate Bill 132 would undermine this fundamental principle by allowing healthcare professionals to refuse to provide care based on personal, religious, moral, or ethical objections. This is not just a theoretical issue. It has real-world consequences that could harm patients. A nurse who is a Jehovah's Witness could refuse to give a bleeding patient a blood transfusion. A registration clerk could refuse to sign in a child of same-sex parents, thus denying care. This bill allows for discrimination and denial of care. A provider could refuse to prescribe birth control pills to prevent pregnancy. They could refuse to prescribe hormonal methods like birth control pills, an IUD, or the patch for heavy periods, severe PMS, or clotting disorders, putting my patients at risk for anemia or worse complication. This bill increases barriers to care, especially in rural areas. When I was a medical student interning in rural Kentucky, the provider I work with refused to discuss birth control with any patient because he didn't condone premarital sex. These patients had no other access to care. This is simply unacceptable. Years ago, I had a pharmacist refuse to fill Plan B for my patient when it was a prescription. Luckily, this was in Louisville where I could find another pharmacy. This is the maddest I think I've ever been as a physician, to have someone, not a doctor, refuse to treat and interfere in my medical decision-making. If my patient had been in a rural area, she could not have received care. This could happen all the time now. If passed, especially with the shortage of pharmacists and reduced pharmacy hours. This bill would disrupt the entire healthcare system. In areas where there are too few providers, patients could be left without care.
Dr. Abrams, I'm sorry, but your time is up, but I'll give you a couple of seconds to conclude.
Okay. If Kentucky passes this extreme refusal law, it would increase the physician shortage, added to our already draconian anti-trans and anti-abortion legislation. Doctors are not coming to Kentucky. We've been looking for a doctor for 4 years in my practice. It will ensure that we'll be 50th among states in healthcare outcomes and amount of doctors per resident. Thank you.
Thank you, Doctor. Appreciate it. Next on our list is David Conway. Mr. Conway, welcome. Again, make sure that your mic is lit. Introduce yourself for the record, and you will have 2 minutes. Thank
Wonderful. Thank you for hearing me, and thank you, Doctor, for pushing the green button. I'm not very technology up to speed. I'm David Conway. I'm a minister, an ordained minister, and a registered nurse, and I appreciate you giving me the opportunity to share my thoughts. I think the scope of Senate Bill 132 is overly broad. Any healthcare worker, even those not directly involved in the medical procedure, could refuse to care for a patient. A receptionist, an ambulance driver, a pharmacist puts the patient in an unsafe situation. The American Congress of Obstetricians and Gynecologists and the AMA oppose bills like this. Appropriate medical care dictates that medical staff must give priority to a patient's care regardless of personal belief. A second problem is the bill offers no provisions to protect patients when they're denied care. This opens the door for delays. As a nurse, a third weakness in the bill is that it increases the risk for discrimination. A healthcare worker could refuse to treat an individual based on that healthcare worker's personal beliefs. Ensuring patient safety is a primary responsibility. You all are aware of that. SB 132 is confusing in some ways. It makes it illegal, and this may be my biggest concern, it makes it illegal for someone to even suggest that an employee who objects to providing care be reassigned to another task. In other words, if I were the lead nurse and I knew that a nurse was opposed to this procedure, I wouldn't have the freedom to say, why don't you take a step out and let somebody else come in? If an employee is uncomfortable providing care, the compassionate action is to reassign them. As a nurse and a minister, not offering another assignment violates the ethical and religious freedom of staff and patients. Churches in rural areas that I have served, many people can testify to how difficult it is, a long drive to the hospital. If the closest hospital denies care based on the staff's religious and personal beliefs, patients will be harmed.
Thank
Two more
you.
quick.
I appreciate your
Am I at 2 minutes?
2 minutes. Goes by quickly, doesn't it?
It does, and I even cut some of it out. Thank you.
You did a great job.
Appreciate it.
Thank you. Next on the list is Dr. Miranda Como. Doctor, I assume the green light is still on your microphone.
It
if you
is,
would,
thank you.
introduce yourself for the record, and you have 2 minutes.
Good morning. I'm Dr. Miranda Bencomo, a pediatrician born and educated in Kentucky. I'm here to advocate for what I think is good medical practice in our Commonwealth, and for that reason, I strongly oppose this bill. While I do appreciate the goal of trying to recruit more providers, I fear that this bill does not actually add anything to achieve that goal. Instead, I feel that it opens the door to substandard care by allowing health professionals to deny services based on personal beliefs without accountability. I disagree with the bill's premise that it's common that providers face discrimination for refusing care that conflicts with their values. Medicine and other healthcare professions have clear standards of what is considered professional. We chose our fields knowing the expectations that our duty is to provide evidence-based care and not to withhold it based on personal ideology. I think it's strictly unprofessional to not provide care that we have good standards across multiple medical organizations to perform to protect our patients. Our ethical guidelines already have a framework by which patients can be referred when necessary, but I feel that this bill takes that too far, permitting providers to deny even basic information and leaving our patients stranded without care, information, and medication that they need. I do think if we want to recruit and retain healthcare professionals, there are a lot of means by which we could do this with real solutions that expand community resources, improve reimbursement, support quality of life for people who live in Kentucky, remove legal barriers to providing evidence-based care, and to hold insurance companies and healthcare institutions accountable for making work in healthcare feel more burning out instead of meaningful in the way that we all strive for it to be. Rather than healthcare heroes, I feel that this bill risks inviting healthcare villains who are welcome to Kentucky to practice outside the bounds of evidence-based medicine. And I don't want to see more providers who would evade medical standards rather than upholding them. Frankly, in a provider shortage, I would rather do the work of 3 doctors than try to make up for the harm performed by one bad one.
Thank you, Doctor. Next on our list is Dr. Caitlin Thomas. Doctor, welcome. Again, make sure the green light is lit on your microphone. Introduce yourself for the record, and you'll have 2 minutes.
Okay. I'm Dr. Caitlin Thomas, a OBGYN who's also born and raised in the state of Kentucky, and I'm here to strongly oppose Senate Bill 132. The fundamental problem with this Senate bill is that it undermines patient safety. It allows providers to withhold care, which could lead to delays, worsened outcomes, or even harm. For example, if a provider refuses to offer life-saving care due to personal beliefs, a patient's condition could worsen while they wait for an alternative provider. Worse still, this bill could prevent patients from receiving critical information about their diagnosis or treatment options. Imagine a patient miscarrying who isn't told about the status of their pregnancy, leading to increased bleeding, infection, or even death. This bill is particularly dangerous for vulnerable populations in Kentucky, such as people of color, low-income individuals, and those in rural areas. These people already face significant barriers to accessing timely and equitable care, and this Senate bill would only exacerbate these issues by introducing a tiered system of care, where the level of care a patient receives could depend entirely on the personal beliefs of their provider. A pregnant woman could be denied treatment, a pharmacist could refuse to fill prescriptions for mental health medications, or for medications helping with miscarriage management. An ambulance driver could refuse to transport a patient to the hospital based on personal views. The potential harm is substantial, and patients could have no recourse if they were denied care. As a healthcare professional, it's my duty to prioritize the health and safety of my patients, especially in critical situations. This bill would allow personal beliefs to take precedence over that responsibility, and no patient should be at risk because a provider refuses care or withholds information based on their own moral or religious objections.
Thank you, Doctor. That's excellent. Minute and 37 seconds. New committee record. Brenda Rosen. Good morning, Ms. Rosen. How are you?
Good morning.
Is your mic still lit green?
It is lit.
Then if
I
you
am
would,
lit.
introduce yourself for the record, and you have 2 minutes.
2 minutes. All right. My name is Brenda Rosen, the Executive Director of the National Association of Social Workers Kentucky Chapter. I'm a proud social worker of 44 years and a very proud medical social worker for 30. I happen to be married to another amazing healthcare provider who spent 12 years going to school to learn how to be an amazing physician. We have practiced in the rural South up to the northeast of Pennsylvania. And I'm here to tell you what a healthcare hero is. That is the person that goes to school, studies, interns, faces the things that all of the different nuances of medical treatment and patient care and assessing and diagnosing through all those years. That's a hero. Healthcare heroes are those who keep in check their ethics, their morals, their boundaries, their faith, and make sure that they pack that. That's always going to be a part of us, but when that starts to bleed into the care we provide our clients, then we are not providing that ethical, patient safety, well-deserved care that every Kentuckian deserves. When we talk about healthcare heroes, I think about all those who died in this state. All those who died in this state from COVID. all of those who die in this state from chronic diseases. Kentucky is the 41st lowest ranking healthcare state in the country. We have the lowest rate of people going into medical school here after the Dobbs decision. My personal faith, my personal ethics, my personal morals, those lend me to making sure that I am providing the best care. And all those years that I watched thousands of children and adults die of cancer and AIDS. This bill opens up a plethora of issues, and if we're talking about conscience, then we have to address the fact that we no longer allow our parents to take care of their gender-affirming children or reproductive rights for planned and unplanned pregnancies. That's a conscience.
Thank you, Ms. Rosen.
Thank you.
Your time is up. Next is Chris Hartman. Mr. Hartman, I know you know the rules. So.
Mr. Chairman, I may not even crest a minute here. We'll see what we can do. I'm Chris Hartman, Executive Director of the Fairness Campaign. So many folks have already said so much. I'll just reiterate that Senate Bill 132 could cause chaos and discrimination in hospitals and healthcare settings. It allows any worker in a healthcare setting to deny services or to refuse to perform key aspects of their job for any reason. And that includes prejudice, without repercussion if they can justify it as not just a sincerely held religious belief, but also a moral belief or an ethical belief. That could be anything. I want to remind you that more than 3/4 of Kentucky voters oppose measures like Senate Bill 132. We polled on it last year, and 3 federal judges have already struck down a similar HHS rule. Very similar to Senate Bill 132. I've emailed you a fact sheet that details all of these concerns. I hope you'll reference it. I would look forward to working with the chair on your concerns about the corporatization of medicine and our hospitals and our healthcare system, but this is not the answer. Thank you, Mr. Chair.
Thank you, Mr. Hartman. Appreciate that greatly. Last on our list is Tamara Weeder. Is that correct? Did I say that right? Mm-hmm. Was that close?
Close. Tamara Weeder.
Okay.
Good to see you, Mr. Chairman. I will be brief. I'm Tamara Weeder with Planned Parenthood. I don't need to reiterate everything that's been said, but I think it's really important to know that since Dobbs fell, we have lost a huge amount of our obstetricians and gynecologists across the Commonwealth. We are facing a mass shortage. And when we look across the Commonwealth, 76 of our 120 counties are facing no obstetricians and gynecologists, none. And so when we look to the future, we know that we are facing a problem with recruitment, and this bill is not going to recruit them. The medical schools took a survey last year and found that the residents don't want to stay in Kentucky because of Dobbs. They don't want to stay because they can't train. Bills like this aren't going to recruit the physicians of tomorrow. They're not going to keep the physicians here. They're not. So when we look to the future and when we look at a physician workforce, we need to make sure that we are doing right by our patients. And Senate Bill 132 is detrimental to our state and most importantly to the people of Kentucky. And if enacted, this would be one of the most extreme refusal laws in the country, and it would have far-reaching consequences for our patients. And so please listen to the providers that came here this morning. They know what is right for their patients, and they know what is happening in the Commonwealth. Thank you.
Thank you. Appreciate it. Senator Douglas, I'm going to give you 2 minutes to kind of do a summation, and we'll move on the motion. Okay?
Thank you, Mr. Chairman. Mr. Chairman, I sit here and I listen to words like could, might, possibly, extreme, will, ensure. I'm never that sure when I'm in my medical practice. You know, the bill doesn't make anything legal. It sets up civil remedies for those people who feel they've been wronged. Everybody else in Kentucky has this. Why don't we? Thank you, Mr. Chair.
Thank you, sir. Appreciate it. There is a motion and a second on the bill. Please call the roll.
Senator Rocky Adams.
Explain my vote, Mr. Chairman.
Yes, please.
I have voted for this bill in the past, and I'm going to be a pass vote today because I've started hearing from a lot of my docs, but the one piece of it that I don't have right now as we move forward are my hospitals. I have Norton in my district, I have Baptist in my district, I have U of L in my district, and I just want to make sure that I run those traps going forward. So I'm a pass.
Thank you.
Senator Byrd. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Herron.
I would like to explain my no vote. I'm going to be a no on this. I know that we continue to hear the words individual civil rights and religious and ethical beliefs. It's just very concerning to me that we continue to pass policy to say that people have individual civil rights basically to discriminate against folks, and that we use words religious and ethical beliefs to allow that. So I'm going to be a no on this. Thank you.
Senator Mills.
Explain my aye vote.
Yes.
Mr. Chairman, I'm going to vote aye. This bill specifically points out objections to the procedures or particular health care services. I think it's pretty clear and straightforward, so I vote aye.
Senator Nemes.
Explain my vote.
Yes, please.
The way it was described, it's the medical procedure that you can object to, not any person or their belief or what they did to get there or whatever. So I am an aye vote because of that.
Senator Rawlings.
Explain my aye vote, Mr.
Yes,
Chairman.
please.
Dr. Douglas did not turn patients away. In the 7 or so states that have this on the books, patients have not been turned away. So it's so much more important to look at track records rather than theoreticals. So I vote yes.
Senator Richardson.
Explain my aye vote.
Yes.
Very briefly, I am appreciative of the generalness of this bill and where it's going. I would probably like to work with you a little bit on maybe just understanding some of the language when it comes to the definitions of moral and ethical principles held by the healthcare professional, just to make sure that that is tightened up. I understand the religious side, but on the ethical and moral principles, just maybe tighten up that language a little bit, because I do worry about some unintended litigation in this.
Senator Tishner. Aye. Chair Meredith.
Aye. By my vote, it's 1 pass, 8 aye, 1 nay. Bill passes with favorable expression. Thank you, Senator. Appreciate you bringing this bill forward.
Thank you, Mr. Chairman. Mr. Chairman, may I say one last thing? I apologize for taking a lot of time.
If you'll be brief.
Yes. Mr. Chairman, I want to thank you and everyone on this committee. I realize that there are some who are going to disagree, but one of the things I want to say is reasonable people can disagree. But when we refuse to pass legislation, or we don't want to look at a subject out of fear, we're not being leaders. And we've been asked to be leaders by the people who have elected us. We can sit here and we can talk about things that are good and bad. We talk about how religion is bad. Ethical is bad when we talk about individualism. But racial inequality and economic disadvantagement, those are okay. So let's just be very, very careful when we start arguing about what we should talk about as individuals and not as individual liberties. Thank you, Mr. Chair.
Thank you, sir. We'll move on to House Bill 219 and also House Concurrent Resolution 20, and Senator Adams is going to be presenting both these bills, and they are related to each other.
Thank you, Mr. Chairman.
Thank you. If you would, please introduce yourself for the record.
Okay.
Along with your guest, and please
Yes.
proceed.
I am Julie Rocky Adams, Senate District 36, and I am actually presenting this bill on behalf of Representative Rebecca Raymer, who could not be here today.
Good morning. Good morning. My name is Jenna Cassidy. I'm the staff attorney with the Kentucky Association of Sexual Assault Programs.
And I'm Caroline Rochelle. I'm the CEO with the Children's Advocacy Centers of Kentucky.
All right. Are we doing 219 first?
if you would like to do 219 first,
I'd appreciate
we can.
that. Thank you, since it's
All right.
on my list that way.
Okay, House Bill 219 is an important step to improve the emergency department response to victims of sexual assault. While Kentucky law requires emergency departments to provide sexual assault forensics exams to victims, the service is not always accessible. So ideally, these safe exams are conducted by a sexual assault nurse examiner, a SANE nurse. And that's a registered nurse with specialized training to work with patients who have experienced sexual assault or abuse. They provide medical treatment, conduct forensic examinations, and care for the emotional needs of these victims. But we know that many hospitals do not have SANE nurses on staff 24/7. So ensuring others are trained on how to respond to victims of sexual assault is critical to support them and to assist law enforcement. So House Bill 219 will require training for all hospital emergency department staff on sexual assault response, including legal requirements, protocols, and available resources. Kentucky law already outlines critical procedures to forensic evidence collection and medical care for victims, and this bill ensures that emergency department staff are properly trained to follow best practices and provide the compassionate, trauma-informed care survivors deserve. So the training will be developed in collaboration with the Sexual Assault Response Team Advisory Committee that is established in statute and includes representatives from Kentucky State Police, Kentucky Hospital Association, and the Kentucky Board of Nursing, as well as others.
Motion.
Motion second on the bill.
Don't y'all want to hear me read some more?
I really did, but
We do have one question. Senator Carroll.
Help me understand. So I understand the shortage of SANE nurses. This is not creating more SANE nurses. It's just an overall basic training for all personnel. And would this result in these personnel collecting evidence, doing the exams, or help me understand? Because as an investigator, I want a SANE nurse doing the exam. I don't want someone that's had a little bit of training on it because the evidence is too critical.
Right. Do you want to answer that? Or?
Yeah, sure. Good morning. So, sexual assault nurse examiners, you'll hear them as SANE nurses, are a special credential, and we love our SANE nurses in Kentucky. We have almost 500 of them registered and credentialed throughout the state. We do prefer that SANE nurses do the exams for victims. However, not all emergency departments have access to a SANE nurse on demand when a victim comes to the hospital, says, I would like a sexual assault forensic exam. This would ensure that the hospital emergency department staff is appropriately trained to say, what are the next steps in helping this victim and offering this care and providing this service when we don't have a SANE present.
So it would help establish a protocol, that a basic outline that any nurse or doctor would be able to follow to care for that victim.
That's correct. And there's actually already policies and procedures in place, both in Kentucky law and offered through other best practice protocols available on the Children's Advocacy Center website for pediatric cases. We have these resources. Emergency department staff just don't know of them.
Okay. And with these contesting these in court when it's not a SANE nurse, that would be a concern.
My background is in criminal prosecution of sex crimes and child crimes, and I agree with you that SANE nurses are most qualified to carry out these exams. However, medical professionals are also equipped to do so, and you can see obviously the barriers and challenges when somebody who's completely uneducated in how to even care for a victim when they come in handles these versus whether if they're educated. And these existing procedures and policies exist to support those who are working in the emergency care setting without their SANE credential.
Thank you, Mr. Chairman.
Thank you. There is a motion second on the bill. Thank you. Please call the roll.
Senator Rocky Adams.
Aye.
Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Herron.
Yes, I'd like to explain my aye vote. I am a yes on this. I have a friend who's a SANE nurse, and so they do a lot. But I will say this. We just passed a bill previous to this, and someone could say, I don't want to provide the exam for a victim. That's the bill that we just passed. I just want everybody to know and understand what we're doing here. Thank you.
Senator Mills,
I vote aye.
Senator Nemes,
Aye.
Senator Rawlings. Aye. Senator Richardson.
Aye.
Senator Tishner.
Aye.
Chair Meredith.
Aye. Vote is unanimous, 10-0, passes with favorable expressions. Thank you. If you would, please proceed.
Okay, great. So I have another sheet of paper in front of me right now on behalf of Representative Rebecca Raymer. And this one is on House Concurrent Resolution number 20. And HCR 20 it's kind of a companion bill to House Bill 219 that we just did. And it will provide us with the data so that we can better understand where the specific gaps are in coverage for access to SANE nurses across the Commonwealth.
Motion.
Good motion. Motion and a second. Senator Kerry, you have a question?
I guess I'm wondering why we don't make this a basic part of nursing school.
Well, I think the resolution is going beyond that. It's collecting data as to why we don't have SANE nurses throughout the state, which I think is kind of interesting, particularly since I know a good reason for that is the shortage of nurses and inability to attract them to rural communities. And I hope this is not an exercise in futility when we complete this. But again, the intent is to let's do a study and gather the data and then come back next session. And if we need to pass legislation, we'll do so.
Yeah.
Is that correct?
Yep.
Any other questions, comments?
Data, data, data.
Yeah, I love it. Becky, please call the roll.
Senator Rocky Adams.
Aye.
Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Herron. Senator Mills.
Aye.
Senator Nemes.
Aye.
Senator Rawlings. Senator Richardson.
Aye.
Senator Tishner. Chair Meredith.
Aye. Again, this House concurrent resolution passes unanimously. And in the future, I'm going to be asking Senator Adams to carry all my bills for me because she seems to do an excellent job here. That's all we have on our agenda for today. Any other business come before this group? If not, we stand adjourned. Thank you. Committee members, next Wednesday, this coming Wednesday, 8:30 in the morning. Get up early. We have bills.
And it's hard to say it. These are great things. It is. It's very rare we go.
What is your last name?
It's a weird name. So we're miles apart.
So my family is all from. I've been gone for a while. I haven't gone back since.
Truly, that only about I have looked at it. I know I've seen you.
That's right.
Oh, aren't you